Doctor, so good to speak to you on this news hour. Do you think that imposing these requirements on anyone coming from China, is it the right thing to do right now? How much of a difference is it really going to make?
Yeah, well, kia ora from New Zealand. Of course, it's one of these areas where it's a trade-off. I think there is a good argument for screening travellers before they depart. That's pre-departure testing. It has two benefits. It reduces the number of infected people arriving in the country that's receiving the travellers. And the other benefit, it also protects travellers on those flights from cross-infection during the journey, which I think is also important. But there are negative sides. I mean, in many ways, China has created this situation by not being transparent in the scope of its own pandemic wave. And if they were to report very transparently the number of cases, hospitalizations, and deaths, and also upload the sequences, the genetic sequences of the viruses that are driving their pandemic wave, as they have done in the past, this would be very helpful, and I think reassuring countries that the risk of importing cases is manageable. But in this void of information, I think it's quite understandable that countries are reacting quite strongly by putting in these requirements. And I think there is a public health argument for them.
When we speak about China not releasing the latest data to the World Health Organization, it is, of course, a concern to the global health body. But by and large, how much does it affect the information we have about the virus itself? And if there is a particular strain in China, because this is a little similar to what we saw 2 years ago, I think, when Omicron was detected in South Africa. And so much of the world then closed its borders off to anyone traveling from South Africa.
Yes, look, I think it's important that countries don't overreact. We increasingly realize that this is a global problem. We know it's not going away. Remember that 2 years ago, countries were, in some instances, still pursuing elimination, and that included many countries in the Asia-Pacific region. So we did need to manage our borders very tightly. Now we're in a situation where, obviously, the world is awash with this virus. In a country like New Zealand, or most countries, domestic transmission is by far the major source. Arriving travellers will make only a relatively small contribution. But it is a contribution that can be decreased. And I still have concerns about infectious people getting on flights where we know transmission occurs. So I think there's always been a public health argument for effective screening of travellers before they get onto flights, particularly when you have tools like rapid antigen test, supervised RAT tests, which are good at detecting infectious people. So I think it is an area that needs to be explored more. The other area, I agree with you, I don't think that we're going to see necessarily new important variants emerging from China in the short term. But I think, again, it would be very reassuring if China was uploading the genome sequencing work that it's doing, just to reassure countries that the range of variants or subvariants there is very similar to the rest of the world, which I think is the case at the moment.
And Doctor, just very quickly, how important are vaccinations in all of this, especially for China and especially among the elderly?
Yeah, well, I think that's the other big concern, this humanitarian one, that China is obviously experiencing a huge pandemic wave. Just based on the sheer numbers of people who get infected, they may well see 1 million or more deaths over the next 3 months. And we would just hope they're doing everything they can to mitigate those numbers. And that means achieving high vaccine coverage in the elderly, and also taking measures that we would use in most countries, which is to flatten the curve, which is to slow it down so it doesn't overwhelm the health system. And this approach has been widely used around the globe, and it is very effective. So obviously, we don't know what's happening in China on the ground, but we certainly hope they are taking those precautions.
We hope so indeed. Dr. Michael Baker speaking to us there from Wellington in New Zealand. Thank you so much, sir.